Welcome along to our our March Wednesday webinar. This month is on the topic of the value of an FASD diagnosis. My name is Barbara Ogston and I'm FASD Project Lead at FASD Hub Scotland and FASD Hub UK. So we have a panel of experts joining us this evening that includes both those with professional and with lived experience. And I'm sure we're in for a fascinating evening. It's going to be really interesting to hear their views and experiences. So the evening is going to take two parts. The first being a part is a discussion between some of our panel. And that's going to be chaired by Professor Moira Plant. And the panel will then be joined afterwards by another couple of guests and we'll hold a Q&A session. We'll be focusing on the questions that were pre-submitted during registration. However, if there's time, we may be able to answer one or two questions submitted through the Q&A function at the bottom, but we will be concentrating on the pre-submitted questions this evening. As the theme of the evening is the value of diagnosis, then we're unable to get into answering questions that are specifically on the diagnostic process. So if you do have questions around diagnosis, please get in touch with our advice line. We can offer support and signposting, and I'll give you some other details at the end of the evening about where else you'll be able to find information. So the discussion panel will be introducing themselves in a moment. However, I would like to make the first introduction of the evening, and that is to Professor Moira Plant, a long-term supporter of the FASD Hub and advocate for those affected by FASD in Scotland and throughout the world. Moira is Emeritus Professor of Alcohol Studies at the University of the West of England, with a particular interest in women and alcohol studies. And as part of the Queen's Nursing Institute Scotland's Healthy Pregnancies, Better Lives project, Moira recently published a report entitled Women, Alcohol, Pregnancy and FASD. And we'll pop the link in the chat to that if you would like to read it. So Moira, I'd like to hand over to you now for the first part of this evening's event.
Thank you, Barbara. Well, good morning, good afternoon, good evening, whatever time zone you're in. We're still on winter time, but I know North America has certainly gone on to summertime, so I have no idea what time zone you're in. I'm going to start right away by getting people to introduce themselves to you, and then, as I said, as Barbara said, we will look at some specific questions. What I'm going to do is just look at you round the screen that I've got in front of me, and if you could just tell us a little bit about yourself and your interest in FASD. Raja's first.
Thank you very much.
His hoarse voice there.
Yeah, sorry, I've got the drag ends of a cold, unfortunately, so apologies for that. So Roger Mukherjee, consultant psychiatrist, and I set up the first NHS-based national clinic for FASD in Surrey. I've been doing this for 20 years after Moira got me involved in this, after starting a conference in 2003. And so I've been doing this ever since, and that'll do.
Thanks, Raja. Carol?
Yeah, hiya everybody. My name's Carol. I'm an adult with FASD. I am a volunteer with the FASD Hub Scotland, the community engagement lead for Adoption UK with their work with the E-Project, and I'm also the health and wellbeing advisor at Fife College.
Thanks, Carol. Bethan?
Hi, I'm Beth McMinn. I'm a consultant paediatrician working in South Wales, and I work in the neurodevelopmental team and have recently developed an interest in FASD. So I'm very young in the FASD world and have been conducting assessments and diagnosis for the last 2.5 years now. So it's quite a big learning curve for me. So thank you for having me.
It's a pleasure. We're enjoying being had, and there's plenty of people around to support, so call on people. Always feel that's important in a field like this. Have I got other people? I've got Gemma, Kate and Barbara on my screen, but I'm not sure whether you are being invisible or whether you would like to introduce yourselves.
Hi.
Miranda,
yes, sorry.
off my screen. How did you fall off my screen?
I have no idea. Anyway,
gracious,
so
that's
all right. No, that's all right. So I'm Randy O'Donoghue. I'm an educational psychologist, and I've been doing PhD research into FASD into the diagnosis and really doing research with young people and health professionals, and I'm going to be working with another group. I'm currently actually on secondment as well to NHS Lothian, and I'm the educational psychologist for the neurodevelopmental pathways as well.
Thanks,
That's
Rhonda.
me. Thank you.
I promise you won't fall off my screen again. It's a big screen. I don't know what happened there. Okay, is that everybody? Barbara, have I got everybody to introduce themselves?
Yes, you have.
Great, lovely. Okay, let's go start at the very beginning. As Barbara said earlier, this is not about diagnosis, it's about the benefits of diagnosis. So I'm sorry this can't turn into a sort of clinic thing. But let's start from the very beginning. What are the benefits of diagnosis? And again, what I'm going to do is go around you as you are on my screen. So Raja.
So this is always a challenge because the so what question always comes up with this. The biggest thing that I think that you have to always say is if the person themselves doesn't understand themselves and the diagnosis it feeds into that, there is a challenge to know to protect, to keep yourself safe, to get the best long-term outcomes. There's something about when we make a diagnosis should be about sorting out what treatment you should have. It should sort out what prognosis you have and should change your trajectory. And that's ultimately what you're trying to do with all of this, is to change people's trajectory from a negative to a positive kind of approach, to help people understand what the nature of the presentation, the wider aspects are, but for the individual themselves to go away and understand what they need to do to have a better quality of life. So ultimately, that's what we're aiming for with this. It's not just giving a label for the sake of it. It's helping shift and change the person's narrative to a more positive approach.
Thank you, Raja. Carol?
Yeah, for me, with as an adult with FASD, reflecting back, I think the thing that's most important to me was knowing, what support to access, like how different my life would be without having the right support, what would I have achieved differently or would I have achieved at all if I didn't have the right support. So yeah, I think for me, the diagnosis is really important to me, just to get, on the right path, and realise that, you are capable of things that you were previously written off for. So yeah, definitely a big one.
So a focus for you so that you could work from there. Yeah, thank you. Miranda?
I think probably just to kind of extend some of those points that Raja kind of mentioned in terms of for, the individual, really a clarity around their self-understanding, their self-knowledge, but also to start that journey on self-advocacy. Because I know parents are amazing advocates, but actually we need to kind of really support our young people to be able to communicate and to identify when they need support. And I think to be able to share that with the professionals or the other adults or, whoever's in their life with peers as well, so that they have an understanding, of kind of how we can all work together or, what that young person's needs are as well. And generally, I think we need that level, the diagnosis for, I suppose, for professionals to understand as well that it's part of a much wider picture of neurodiversity within because I think we tend to kind of segregate, FASD diagnosis, and we don't consider it within that much broader kind of neurodiversity picture that we all live in with this in society as well.
Thanks, Miranda. Bethan?
Yeah, I think I would agree, really. The main reason for any, or main value for any diagnosis, any neurodevelopmental diagnosis, is firstly the understanding that brings. So the understanding of the self, the understanding from a parent perspective, education perspective, because if we don't understand the why and where those difficulties are, then it's very difficult to start knowing where to support. And I, it's only been the last couple of years I've been doing these assessments, and from the little experience I've had already is that one of the common things that families are saying is they've got a diagnosis of ADHD, but there's something more that doesn't really explain why they're having so much difficulty in all the other areas of function in school and at home, and we want to know why they're having those difficulties so that we can then better support them. And for me, it makes sense as well. When I'm listening to them, I think, yeah, I think there is more than ADHD here, actually. And ADHD support alone is not really enough. So as a clinician, it's helped me as well, like Miranda said, to have that wider neurodevelopmental lens, not to just be thinking about attention and hyperactivity, but to be thinking about all the other neurodevelopmental domains that can be affected, and trying to, you know, provide that wider holistic approach to the support and assessment, really.
Thanks, Bethan. That leads quite nicely onto one of the other questions I had, so I'll just go straight to that one. What value would it add having an FASD diagnosis on top of ASD, ADHD, sensory processing disorder, anxiety, dyslexia, dyspraxia, nystagmus? There's a huge list of them. We're back to you, Raja.
Yeah, this was part of my PhD kind of area. The thing you have to bear in mind is FASD is an etiological diagnosis. What that means, that is the cause of the underlying brain and body damage. All the other things that you describe are the outcomes of that brain and body damage. So dyspraxia, ASD, ADHD, they're outcomes. They are not a single thing. There's a broad range of presentation. So line up 10 people with ASD or 10 people with ADHD, they'll all be different. And one of the things that defines the differences are the things that cause those outcomes, because etiology, causes of problems, are to do with the pathways that are damaged within that. So whether it's a genetic condition or whether it's a teratogenic condition, as in this case, it's the pathways that will vary and change. And so if you want to know the differences between these factors within a spectrum, you have to look at the complexity of that individual. As Bethan was saying, it doesn't always fit and feel like a classic ADHD case or a classic ASD case, because they're not, because they're a different phenotype, a different type of presentation within that. And so you have to understand cause and outcome. And the two are combined together in terms of understanding how that fits. Now, that's not how everybody thinks, but that is the relationship between these, and by understanding, you understand the complexity of the individual. The problem that we've got is that we treat conditions, we don't treat people. And I've been saying this a lot recently, is that what we should be doing is creating pathways that treat people rather than treating ADHD or ASD. We treat the person in front of you. And that is a combination of the complexity, and that's the kind of things that we should be doing. And that's, you know, what we've done, and that's what I was going to say. FASD has taught me more about all these neurodevelopmental conditions than any other thing put together, because it is a complex neurodevelopmental disorder. And if you understand FASD, you understand the whole lot of the other stuff.
Thanks, Raja. Carol?
Yeah, I've not really got much more to add on top of that. It's just hit the nail on the head. I think for me, it's just focusing on, you know, about it being a person. So one person like me having FASD is totally different to the next person. So it's again, you know, it's that person's centered support and understanding it a bit better, and the added value on top of everything else as well.
The whole person. Miranda? Earth to Miranda.
Sorry, I'm just unmuting myself. Apologies. All the technical things that ever happen on this. I think with the complexity of neurodevelopmental conditions, I think it's really important we talk about neurodiversity, but also the fact that there is an explanation, and that we're not, as maybe as practitioners, we're not missing that, and that we're not kind of, because I think when we don't kind of go forward with that diagnosis or look at that, you know, as part of our assessment process, we're missing that. We're missing the, you know, the much wider kind of complexity that's going on, and then we're not adding to our practitioner skills and knowledge, and that's from a different perspective. We're not adding to the evidence base around FASD if we don't actually diagnose it as well. So that's just probably a different perspective on that.
Thanks, Miranda. Bethan? While Bethan's unmuting herself, there's very interesting conversations going on in the chat as well. Bethan?
Oh, sorry, I didn't have anything to add really to that.
That's okay. That's okay. Well, you were the one that started it, so I think we can let you away with that one. An interesting one. Why are clinicians reluctant to diagnose FASD? Raja, we're back to you, and I can see you smiling there.
It's confidence, most often than not, is when you start to talk to people. if they've got a background in neurodevelopmental conditions and you start training them, they suddenly start saying, oh yeah, that makes sense. Oh yeah, that makes sense. But if you don't train people, they don't have the confidence to do it. This is one of the fallacies, is that we can't just say to people, right, go off and do it. You need to teach people what to do. You know, there's a maxim in medicine is do one, teach one, do one, see one, do one, teach one. And it takes a little bit more than that when things are this complex. And I think that is part of the problem. They have a vague understanding. They may have been taught pre the 2000s that it's all about the face when it's not. They may have been taught different things and they're not sure what there is real and what isn't. And these are the kind of things that you start to understand. I need somebody who can help and support me. That's why I'm such a big advocate of hub and spoke, because you get access to support and confidence in growing whilst they are developing and growing themselves. And so, keeping it short, I think confidence is a huge factor for a lot of people in terms of that, and then taking the bits they know and adding to it.
Yeah, I think it's a really important issue. And I think for me, stigma is in there vitally importantly. We can come to that a bit later. Carol?
Yeah, just to echo again what Raja said, I think it's more the fear of the unknown. We know that there's a lot of great work getting done with FASD, but like thinking back to where we are now, where we still need to go, there's still a long way till we get there. But I think it's more if they're not really sure, it's like opening up a can of worms sort of thing. And I think that's one of the big deciding factors around that.
Thanks. Miranda?
Well, I suppose actually I'm just finishing up my second study as part of my PhD, and I have been speaking to clinicians across the board, across several kind of areas in Scotland. And I suppose what's coming out kind of initially from some of these interviews is the conversations from practitioners or clinicians who are really, really sensitive to their patients, who are really who may have issues sometimes with kind of their level of knowledge. But it's, I suppose, those interactions and the concern about the impact on the relationship that they're going to have with their patient. So especially when they're asking for informed consent, you know, to then look at FASD, the concern they would have about having an impact in terms of, you know, the kind of harm and the benefit in, you know, if we were to share that diagnosis, you know, kind of that consideration as well. So I think there's a lot of concern around the actual harm that it may do, and that then builds into that kind of stigmatizing concern or kind of knowledge or attitude that kind of is held with, we know, across kind of different profession groups as well.
Thanks, Miranda. It's important. Bethan?
Yeah, it's a good question. I don't think personally we've had any reluctance to give a diagnosis, in that as a department we recognised that we needed to start doing this because there was an unmet need within our population, and that there were children and young people we were seeing probably with FASD, but we didn't really have the setup or the skills to do it. So we've had to, you know, and I'm going to be honest, it's been difficult because of resources and training. You need to have a multidisciplinary team. So you need to have people with those skills to assess those different neurodevelopmental domains. And not every department in every health board has those readily accessible skills. So we've had to try and put something together over time, which has been challenging, but definitely doable, but very difficult in the current climate of limited resources, lots of focus on ASD and ADHD, and people saying we haven't got the resources to add another neurodevelopmental diagnosis into the mix when we can't even meet the demand for ASD and ADHD. So that is the reality. But I think the right thing to do is to say, well, we've got these children in our care and we're not doing right by them by not offering the service, so we've got to do something. So there hasn't been a reluctance from a clinician's perspective, but a resource perspective.
Can I just come back on that a tiny bit?
Yeah, sure, Raja.
Sorry.
That's okay.
One of the things I always do when I do a talk on this subject is with clinicians is to get them to say how many people have seen someone with FASD. some people put their hands up, many people don't. How many people have seen a child in a looked after children's? A lot of people put their hands up. How many of those have had neurodevelopmental conditions? They keep their hands up. You've likely seen a child with FASD then. They are already seeing these people, and without no extra increase in resource, no extra change in pathways, just the fact that they start to recognize it is a big shift. And you don't have to suddenly say you're going to get lots of extra referrals. It's just being able to recognize within your own ready existing pathways that people need to start doing. And I think that is one of the challenges at shifting people's mindsets.
Thanks, Raja. That really leads us on very nicely. Oh, you are all behaving so well tonight. Next question. Can you provide a brief explanation? And this could be very complex, but I want to try and keep it simple in terms of when you're talking with other professionals, the chances are you don't have a lot of time. So you have to get the message over quite quickly. So the question, the statement is, can you provide a brief explanation which could be given to professionals which would help advocate for a diagnosis of FASD rather than autism, which many professionals believe, and as a number of you have said, people will give a diagnosis of autism because there are services available and support. So brief explanation to give to professionals about the importance of a diagnosis of FASD. Raja, do you want to come in with that, or do you want to wait and see what other people are saying?
I'll wait for others. I've gone to first too many times.
Oh, you've been so nice tonight. Carol, is that something that for you is an issue? That how would you like professionals, big question, how would you like professionals to behave?
Properly, like FASD is not autism. Simple. In my eyes anyway. But yeah, it's just, I think, there is the funding out there for autism, that because it's, it's known about, but we need that for FASD as well. So if we're not getting a diagnosis and providing the stats and everything, then we're not going to get the support for it. So it's just to keep fighting the fight and have, your young person recognised for who they are rather than a tick box exercise.
Thank you. Miranda?
I think that was a brilliant summary from Carol of, FASD is not ASD like anything else. No, and I really do. I genuinely think that. I think we would not be doing any service to young people or families if we didn't recognize that every child is an individual, their profile of their needs, their values, their strengths, what they love doing. If we just kind of brushstroke and just ignore that, we're missing the point of, what's going on for them and what's meaningful for them and their family. And if it's FASD support or if it's parenting strategies or whatever it might be, it should be for that individual's needs.
Yep. Couldn't agree more. Bethan?
Yeah, I agree, really. It comes back to that understanding. I mean, I find it interesting that people question the value of neurodevelopmental diagnoses, but they never question the value of any other medical, a medical diagnosis. You'd never say, what's the point of an asthma diagnosis, or what's the point of a... So I just think that's the whole purpose of a diagnosis, is to understand how to manage and support and help that. So it's the same, I reiterate what everyone else has said, and I find it an odd question sometimes when people wonder what the value of the diagnosis is.
Yeah. Raja, do you want to come in, or happy to leave it?
I'll come in. There are a whole group of people who don't see the benefit because they don't see the so what, they don't understand it, and it comes down to, well, that's about you, that's not about the people who have FASD. That's the first thing. The challenge I always give back to them is, if you had somebody sitting in front of you who had Down syndrome, would you refuse to diagnose it? And I've never met anybody who would say no. And the reason is because it's easy. And so what they're basically saying is, it's hard to make the diagnosis, so I can't be bothered. or I don't want to because I don't know what I'm doing. And there's a challenge there, because if they say they will make the diagnosis and there's a value to it for something with Down syndrome, there's an absolute exactly the same argument to be made for somebody to make a diagnosis of FASD, because there's an individual difference and variability with an individual who has FASD, which is exactly the same reason you would make the reasons as the diagnosis for somebody who has Down syndrome, Fragile X, or other causes. They don't do it because they don't know enough, and we need to educate people to try and change that. And challenging people on those things. We did this recently in a training in Manchester, and you could see somebody's eyes just light up and start to click, that they realize actually what they were saying was just ridiculous, and that actually there is real value to understanding, because everybody is different and unique, and actually we need to understand the differences and the uniqueness of that comes with the FASD, whether they have autism as a comorbidity or not, which is part of it.
Thanks, Raja. So confidence and competence. I'd like to move on now to one of the other headings we have, which is diagnosis through the life course. And the first question is, how can I use my child's FASD diagnosis to access more support in education? Bethan, would you like to start us on that?
Yeah, I think this is trickier for us at the moment, because I think the knowledge and understanding in our area is probably quite behind in terms of FASD and how that can present, and the neurodevelopmental diversity within that. So I think there's a lot of training to be done in the education sector, which I think, you know, is happening and will continue to happen, because obviously the more we diagnose, the more there's going to be a need for them to understand. But I think, you know, from what I've heard from parents so far, that the report, often the report that you provide as part of the FASD diagnosis, outlines those strengths and difficulties quite clearly in the different neurodevelopmental domains, that then the parent can take and advocate for their child to say, look, they have recognised severe impairment in these domains, and this is what they need support for. And also at home, the understanding as a parent.
Mm-hmm. Thank you. Miranda?
I suppose from an educational psychology point of view, and a kind of very pragmatic response, I think just picking up on what Bethan was saying is, you know, obviously having that profile of the child's, you know, their strengths, their interests, and their areas for development, or their areas that they identify with in terms of needs. I think it's really important that you communicate that really effectively with a school. In Scotland, we have the Getting It Right for Every Child planning framework. So that's a kind of, I suppose, support system. Sorry, not support. It's a planning system that takes account, you know, across our different universal services of health and education and social work, the awareness that we need to engage with families, we need to recognise neurodevelopmental differences as part of neurodiversity, and we need to have really kind of concrete action plans. You know, if somebody's bringing you this, it's not just a label. There's a whole disability within that. The person's living with that. The family's living with that. So it needs to be a more preventative kind of, I think, response, rather than something that's quite reactive. So I definitely, advocate for a very pragmatic view of working with education. So having a really clear partnership with school staff.
Thanks, Miranda. I just realised I'm going to get a row from Barbara, because I said I would start off, I agreed to start off by getting everyone to introduce themselves, and I forgot to do it. I'm sorry, Barbara. No chocolate cake for me this afternoon.
I think you did do it, Moira.
Did I? Yeah, you're just being polite. Carol, what about you? How does the FASD diagnosis help or could be used in education?
Yeah, so for me, like, I work in a college now, and to my own advocacy, I am shouting about FASD within that, you know, institution, which has led to, you know, we've had FASD Hub have come into our college and done talks and things like that. But I think it needs to be, you know, just touching on stuff before, rather than being reactive, be a bit more proactive. So it'd be great to have, you know, FASD training is a mandatory thing, that all new staff and old staff should all get trained up on what FASD does, because it's literally like having a school system that doesn't know what autism is, and FASD is more commonly known than what autism is. So yeah, again, it's this whole unknown. So if they're not sure about it, then why are they not finding more out about it? And I get that everybody is a bit behind with that, but I think it's just being an advocate for your child, or if they, you know, they are more capable of speaking up for themselves as well, as making sure that they're that person that's centered in how that looks for them, and how that isn't how it will be in primary school compared to high school, compared to life, compared to adulthood. It's ever changing and ever needing updated. So it's just making sure that if they don't have a voice to speak up for them, that you're doing it, which I'm sure everybody is anyway. But it's just to keep going with that, and you know, eventually, hopefully, we'll be in a much better place where we won't be having to fight so many battles around it.
Thanks, Carol. Raja?
Yeah, I think I go back when we talk about education to things that I've spoken to other people about, and people like Barry Carpenter jump to mind. And he used to say to me, Raj, you can tell me what's going on with the brain, but I'll then tell you how to teach it. I'm not an educator. I'm a psychiatrist, and I'm a physician. I can diagnose somebody, but I'm not going to tell you how to teach it. But the key issue is, if I don't tell you what's wrong with the brain and how they process and do things differently, you're not going to know how to teach it differently. I think that's the crucial bit. The diagnosis should be about EHCPs in England, an educational healthcare plan equivalent, or wherever it is called in the different countries, to then be put in place to say, this is how you teach this child differently. This is how you get the best outcome, because what you're looking for is to give them the greatest opportunity to learn, because these kids want to learn. They want to go in, they want to do and achieve. And if we don't give them every opportunity to do that, they will fail. And we know full well that if we build on strengths, that there's a lot of positive outcomes, but if you build on weaknesses, they will get worse. And so this is about teaching people in the positive way, so we can actually do that. And the diagnosis is step one in actually teaching you, but you need to know more than that, but it's a step one in actually teaching them.
Thanks, Raja.
Moira, sorry, could I just add
Of course.
to that? Yeah, I think, I mean, I recognize a lot of parents and carers have been quite frustrated, you know, in terms of the educational process. And I think, you know, what Raja was saying about that brain-based difference is a neurodevelopmental difference. So understanding fundamentally, you know, choice, you know, it's not necessarily a choice. And there's a lot of, you know, kind of explanations and knowledge and reframing to support practitioners to really scaffold children's interest, their learning, their engagement with education, full stop. So yeah, I think that fundamentally it's a neurodevelopmental difference, and understanding what that means in the first instance.
Thanks, Miranda. We're talking about diagnosing through the life course. We've been looking a lot at education. Is it worth adults in particular seeking a diagnosis? Carol, can I come to you? Because it was a bit later before you're just a kid yet. I mean, when you get to the ripe old age I'm at. But Carol, would it have made a difference to you to have a diagnosis earlier?
Yeah, so I was diagnosed at birth, but obviously my adoptive parents didn't believe FASD was a thing back in the 80s. So I'm giving my age away, I'm older than what you think I am. But yeah, I didn't know I had FASD until I was, early 30s, late 20s, early 30s. So yeah, the big change for me was knowing I had a diagnosis when I went back to college as a mature student. I went to university where it totally failed, so you can imagine me going to university on my own as an 18-year-old, but with life skills like a 10-year-old, so it failed dramatically at that. So I never thought I was capable of it, but when my adopted dad passed away, he told me to go back to education, and that was the reason I went back. And conversations were a lot more open then when I was younger, so I spoke about my background, I spoke about having FASD, we spoke about the struggles and the strategies, and at the time the college didn't really know much about FASD, so it did open a big door for them to start looking into things. And I've got a really good relationship with the learning department and the inclusion department at the college at the time that I work at. So they really helped me to realise, you know, kind of fitting that jigsaw piece together about why I did things when I was younger, why I made these mistakes, why this went wrong, why that didn't work out. So for me, it was like a whole big turning point for me. I understood myself a lot better. I understood what I struggled with and how to put them at bay. I learned that I already had coping strategies and just thought it was my normal day-to-day way of coping with stuff. So just to make you aware, I'm always like a hamster on a constant wheel. If I keep myself overly busy, I keep away from all the bad stuff that I did in the past. I have spent lots of money or just been silly, so to speak. So yeah, I work 2 jobs and I volunteer and I've got 3 kids and I was studying, and that's just my coping mechanism, which does sound stressful, but for me that's my way of just getting through life on a daily basis without getting in trouble. But yeah, definitely worth getting it. You know, because the thing is for me, you know, I've now got 3 children. So like when I didn't know I had FASD, you know, I didn't have responsibilities, I didn't have mortgages and stuff to look after, which I've now got now. And with the right support, not only from like family, but work and education, I've went on to do things that I probably would never have been able to do before. So yes, it is definitely worth getting one. I know it's harder when you're older and stuff to get a diagnosis, and for me I was lucky that I had one from birth, but yeah, make sure to try and get one. It is really, really important, and I'm pretty sure in 10 years time I'll be facing another load of difficulties, and the new one for me is all these health conditions that I'm now suddenly getting. So yeah, I think there's a lot more stuff to come, but we're getting there and it's a lot better than it was.
Good. Your hamster on a wheel is such a wonderful description of how exhausting it is. Bethan? And yeah, is it worth getting a diagnosis as an adult? I'm wondering if you got that.
Oh, I don't have any experience of that. And to be honest, I was just kind of in awe of Carol then as she was talking. So I was a bit kind of speechless because I just thought, wow, and kind of echoing everyone's comments on the chat really, because I was looking at that as well. But thank you, Carol, for being such an amazing spokesperson for adults with FASD and children and young people.
Absolutely. Thanks, Bethan. Raja?
I go back to, so Carol said it very well, but I always go back to what Lee had said to me. Lee, somebody who people will know on this, he's one of the adult group, and he walked out of my clinic saying, I now understand what I need to do to keep myself well and how to live my life differently. And that for me stands out. And he was 25 when he came through our clinic. And, you know, that fundamental change of the understanding of the individual to change their lives for better makes a difference, and that's what you're trying to do. Ultimately, as we said right at the first question, we're trying to change people's trajectories from a negative to a positive quality of life, and that is one thing that it does. So getting a diagnosis, if it makes a difference to your life, go for it.
Thanks, Raja. I've got a question here, and I'm actually hesitating about it because I think it could take us into so many places we don't have time for. What can I do? What can I do if the clinician doesn't agree? Clinicians don't agree with each other on my child's diagnosis. Raja, what are you smiling at?
I'd butt their heads together first.
Okay, smack them.
Yeah, but I'm not.
Okay.
No, I didn't say that. I just didn't say smack them. Just said.
Sorry, that was my inner Moira coming out there.
Yeah, it was. Yeah.
Bang their heads together.
But this is where actually there's the supervision and the expert opinion. The differences come because there's lack of understanding and difference of opinions, and the understanding of how these all things sit together. And that again is where education, supervision, and that whole training aspect comes together. People don't suddenly become experts, they grow with it, and having access to, well, what do you think? You still have peer groups of clinicians coming together to discuss cases and say, well, what do we think about this? Because there are grey areas and we need to have those discussions to do that. But if there's no forum to have that, what do you do? And so in a sense, it is having the expert coming in and saying, actually, this is right, this is wrong. And that is something that is missing in a lot of places.
Thanks, Raja. Bethan?
No, I don't have anything to add, sorry.
Okay, no need to apologise. Miranda?
Sorry, I think obviously I'm not kind of a clinician, but I'm working on neurodevelopmental pathways, so it is a kind of interdisciplinary approach. I think probably for clinicians and practitioners as well, I think it's really helpful to have what Raj is talking about is that kind of level of a safe space to explore, to understand things, to build your confidence, to kind of ask all those questions, and to access appropriate CPD, and to obviously have a kind of strategic direction of travel within our different health boards and across education would be amazing, so that clinicians do have the opportunity to understand it is a priority and it is part of neurodevelopmental pathways, and I suppose for parents to know that, because what we don't want, what I've heard from parents as well is that kind of sense of a struggle and a battle, and that's a really unfortunate experience where you're trying to advocate for your child and it becomes a battle, and a frustrating battle at that.
Thanks. Carol, I don't know if you've been looking at the chat, but boy, you've got a fan club out there, dear. Is this question something you want to add to, or is it not something that you feel particularly one way or the other about? I've lost you off my screen.
Yeah, I would just butt heads again. Like I'm not an expert in any way, but yeah, I would agree with Raj on that one. Just keep fighting. You know your child.
You saying you're not an expert just does my head in a bit, dear. Okay. The last heading we've got is acceptance, and the question I've got on it is, what role does stigma play? And this is huge. So I think, Barbara, once we've all had a talk about this, if I hand it back to you, because I think that's probably the best way of doing it. Miranda, what part does stigma play?
I think I've got so many thoughts on this topic, so I'm going to be trying to be good about this.
Fast.
Yeah, okay. So I think in terms of the discourse around the research, what we encounter kind of just from kind of, I suppose, across the board, is that there is a huge factor of stigma, and stigma seems to be tied to FASD diagnosis, and obviously that FASD diagnosis it's assumed as a label, but it's not. It's the whole complexity of FASD, the disability, the diagnosis, the process of understanding your identity in relation to that as well. So what's really interesting is when you look at all the other neurodevelopmental conditions like ASD, intellectual disability, and psychiatric disorders, what we know from that is that yes, stigma does come into that picture. So adolescents do experience, a kind of some stigma to some degree, and that's probably part of the negative impact, but actually that's really outweighed, and in the research that I've done with young people, is the process and the journey that they will go on in terms of learning about themselves, understanding the nature of a disability of FASD, what it's like to live with that, how they need supports, and how they understand the diagnosis and the importance of it as well. And kind of as they mature into adulthood, that process of understanding and acceptance, and becoming advocates for themselves. So probably I've not been very succinct there, but there's just so much around it. And I just think we need to really widen the conversation beyond stigma, and just the diagnosis, and actually consider FASD as FASD in itself.
Thanks, Miranda. Bethan?
Yeah, I guess I agree with Miranda and what she said about trying to move away from that associated stigma and just think of it just as another neurodevelopmental diagnoses. And I think, trying to have open and honest conversations with people about alcohol consumption and the fact that it's just very common and pervasive in our society. So, a lot of the time people aren't aware that they're pregnant when they are still drinking alcohol, and it's trying to shift that kind of blame culture away from this, because that's what's harmful about it, I suppose, isn't it? And I think we just, as professionals, we have a duty to just kind of hold those open and honest conversations without blame, because that's not what it's about. We're looking for a neurodevelopmental diagnosis that we can support in the context of a society which is heavily influenced by alcohol. It's the most commonly consumed toxin, you know, at a national level. So there's a lot to do within society as well around this. It's a massive topic, but you know, having been working on this, I've been more acutely aware just how much alcohol is around us in everyday life. And you know, I only went to a restaurant at the weekend and there was bottomless brunch on offer, and you know, I was being asked multiple times about whether I wanted 2-for-1 cocktails by the waiter, and I thought, how many times do I have to say no? But it's making money, isn't it? The alcohol industry makes money, and it's, yeah, I mean, I think I've gone off a bit there on tangent, but
Thanks, Bethany.
Just trying to normalize it, isn't it?
Raja, briefly.
Are you sure?
Yes, very.
Okay. There's a few couple points. I'll try and keep them brief. First of all, it prevents progress. And I think it's an excuse that people can use to stop it. And if you think back to the research we did back in 2009, published around that kind of period of time, it was pediatricians and it was other professionals who had the greatest stigma. They were the ones who were reluctant because of the fear of what they're doing. There's an element of they didn't know what other people didn't know, and it perpetuates a situation. It doesn't allow progress. What's really interesting is that if you actually get into this, and both from the Birth Mothers paper that we published, but also when you get into this from our prevalence study, when we actually had people who came forward who turned out to be birth parents, they're coming forward because they're realizing there's something wrong with the children. They're coming wrong because they identify there's something not right here that I need to get help for. They're not doing it because they're doing it on purpose. They're doing it to try and get help. So they're looking for help. And the professionals, by not addressing this, are not actually helping. They're just burying their heads in the sand. There is something about actually an element of head-on facing. There will be an element of grief with this. And it's not worth saying we're not going to get that, because you're going to get the thoughts behind it anyway. There will be grief, and what we should be doing is supporting people to work through that grief, to come out to get the best for the kids and their parents and the families in the long run. And that is one of the things that shows is improved equality. And you look at people where you've got birth families, and those of I've seen that CJ and sort of Jan and other people who knew Pip as an example of a really powerful advocate of a birth mum who was wonderful in advocating for that and had worked through her own grief to a point where she was a powerful person in this field. And we all miss Pip, obviously, but it's one of those where it just shows that we need to help people through a journey, and professionals, by pretending that, you know, the stigma is going to do it. We don't want to blame people. We're not blaming people. We're trying to understand the individuals to get a better quality, is stopping that progress and stopping the people getting the help they need. All right, I'll shut up now.
Thank you.
I did say.
You did. Carol, very quickly, I'm conscious of time. We've only got 10 minutes left, and I know Barbara has questions. I'm sorry. Carol?
No, you're all right.
You've all just been too interesting. That's what it is. Carol?
Yeah, I think stigma's a massive one. You know, I've lived with stigma all my life, whether it's being adoptive or having FASD. And I think when my adoptive parents took me on, when they were told, she'll not achieve much academically or socially, brace yourself kind of thing. I think that's why they kind of pushed it to one side. But I think there was a part of stigma there. Like, my mum didn't want people to think that she drank with me, and that was back in the 80s. And that stigma's still here now. But the message is slowly getting through. I mean, my 11-year-old has been learning about alcohol and pregnancy, and how actually, you know, this whole thing where we were told it's okay to maybe have a glass of wine now and again while you're pregnant, it's totally fine, is not the right thing, the way to be going down. So the message is getting out there, and that people are starting to talk more about it. But I think it's just more, it's that awareness that, you know, it's not because an alcoholic mother, somebody could have like drunk throughout the whole thing, somebody might have just had a little bit, and it could have a more detrimental effect. There's other factors that impact FASD as well, with regards to, like, you know, neglect and nutrition and stuff like that too, and how susceptible you will be to have, or how bad your FASD will be. So I think, again, it's that whole education. It's more the ignorance to want to know or not know, and it's also talking about the stigma and how that impacts it as well. I'll shut up now because I could talk for ages.
Well, I could listen to you for ages, so that would work very well. Yes. Barbara, yes. Can I hand back to you? Is that okay, or what do you think? Where are you? Oh, there you are.
Yes,
Hi, Barbara.
I'm here. Hello, I'm back. Yes, absolutely. Thank you very much, Moira, for chairing the first part of tonight. We've we're here until 9:30, so we've got plenty of time to get some more questions, and I really appreciate everyone answering all the questions on the panel, and we'll come back to you in a few moments with some more questions, but I'll let some of you have a little breather for a moment. I would just a couple of things. I have a colleague, Gemma, who can turn her camera on. Gemma will appear in a moment, but there's been a lot of great comments in the chat. I don't think I've ever seen a chat thread so busy. Lots of really good supportive comments and questions, and a lot of people have been asking about adults with FASD. So I can tell you that the Scottish Government have awarded Adoption UK funding to explore, to do a scoping exercise, looking at how peer support might work for adults with FASD, and Carol is going to be leading up that piece of work for us in Scotland. It's going to look at Scotland, but there is also, it will expand into England and internationally, just in terms of information gathering, and then we can look at what support at a later stage we might be able to provide. So if you are interested in finding out what's going on and being added to our database of adults with FASD, so Carol can get in touch with you once we're up and running, then I'll ask Kate, who's behind the scenes, to put our email, to put our hub, FASD hub email address into the chat, and we will add you onto our list, and we will be in touch, because I think quite a lot of you would be interested. Now, just give me a moment, because I'm
not actually able to switch my video on, so if somebody could do that.
Okay, I'm just going to do it for you, Gemma.
Thank you very much.
If I can find you, where are you? Here you are. There you go. You should have a request asking you to start.
I've got it. Thank you. Hi.
Hi, Gemma.
Hi.
So we're having a bit of a kind of swap around now. I'm going to take over the hosting. Gemma has come to join us as a parent of a child with FASD, so we'll get Gemma to talk a wee bit in a moment. Gemma is a very welcome last minute substitute after somebody dropped out ill today, but she's very used to doing this, and I'm sure she won't mind if I ask her lots of questions, because she's quite used to it. And Moira is also now joining the panel and will answer some questions too. But before we, well, actually, I'm just going to start with Gemma and ask Gemma to introduce herself and have a wee chat with Gemma. I'm then going to move over to Moira, who's going to talk a little bit about stigma, which is a particular area, and I know we've touched on it, but we'll talk about it a wee bit more with Moira. And I'm going to land Miranda in it as well, and hoping that she might share a wee bit about her lived experience research that she's been doing with children and young people. So I'm giving you a couple of minutes there, Miranda, to think about it, because I know you'll be fine with that. So Gemma, would you like to introduce yourself and tell everybody a bit about yourself?
Sure. So hi, I'm Gemma. I'm the I work as the FASD Hub advisor, advice line and community advisor. I've worked for the Hub for a couple of years now. I do lots of varied things. I oversee our peer support group. I answer the helpline. I help develop and deliver training. I work with families, but as Barbara said, I'm kind of here tonight with my parenting hat on. So I have an adopted daughter. She's just turned 9. She has a diagnosis of FASD and ADHD, and she received both of those when she was 4. That's just a little bit about me.
And from a parent's point of view, what do you feel is the benefit of a diagnosis?
Well, I started writing some notes and I didn't really stop, so I'm going to very briefly try and summarize what I wrote. So the benefits are, lots of people have said it very eloquently this evening, which I completely agree with. The notes that I came up with for the parents, first of all, that, and again, this is based obviously on my personal experience, but also speaking to other families as well, a very common theme is that the parents feel this relief that it's not their fault and what's been going on, because due to the stigma and everything that people have been talking about today, it can be very, very isolating, not understanding what's going on in your family with your child. So having that understanding and that sense that of isolation being lessened was the first one, and that can hopefully lead into a shift in parenting style, parenting approaches, and understanding their child's behaviour. Again, speaking personally, it was a very big light bulb moment for me when I first found out about FASD. It was that shift in thinking from these are not conscious, controllable behaviours, these are actually symptoms of a brain-based disability, and that enabled me to then kind of shift the way that I parented and advocate for my daughter. for my child, for my daughter. I mean, she, from a very young age, she would say things when she was in one of her sort of dysregulated states about, you know, I want to hurt you, and my brain's telling me, or, you know, I want to hurt you, but I don't. And she was very confused and very conflicted. And I used to say, you know, well, I'm going to help you. We're going to figure this out together. And she would say to me, you know, at the age of 3 or 4, how are you going to help me? How are you going to stop this? Because she couldn't. And this was how getting the diagnosis was the start of the journey of figuring out how to support her and how to help her. And that very clear shift from, I'm not, you know, it's such a cliche, but I'm not a bad kid. Because she truly believed that there was something really seriously wrong with her. And whereas now, you know, we've done a lot of work in the past 5 years, you know, looking at all of the strengths, you know, that FASD brings, as well as the challenges, and she understands why she sometimes behaves in certain ways. But leading on from that, understanding why is how to support her. I mean, it was Carol that said, you know, you meet one person with FASD, you've met one person. They're all different. So it's about sort of discovering what soothes her, what helps her, what things she finds difficult. That self-confidence and that self-esteem, and the change in her just the last couple of years in terms of her self-confidence and self-esteem, it's incredible. And I think that all stems from getting the diagnosis. I've still got things like when we went traveling, we went to Florida, really kind of physical, tangible things. You know, we had help, like she didn't have to stand in long queues. We went through the kind of fast track. It kind of opens up these supports and benefits and things that just they wouldn't be there for her in terms of literal financial benefits. I work part-time, and benefits from the diagnosis help me do that, so I can provide her with that routine, with that consistency, with that, you know, me being present. Education, having a diagnosis that opens the door to rights and responsibilities. You know, the list goes on and on and on.
It does. And just from a parent's point of view, do you think there's any disadvantages to having a diagnosis?
It's funny, when I first heard this question, I immediately said no. The only one that I can really think of, and I'm going to be brutally honest here, is, and again, people have talked about that stigma. Usually, at least once a week, you know, if I'm talking to a parent or I'm explaining away some kind of behavior, and I say, you know, if I choose to share with that person that she has FASD and ADHD, you can see the judgment very, very clearly, that kind of taken aback. Oh, and I do find myself, not all the time, but more often than not, saying, oh, and she's adopted, because I'm only human, and you get that reaction from people, that judgment from people. And that is me being very honest, because I am a true believer of there should be absolutely no stigma or blame, or, you know, no mum would hurt their child. I know that, but on the other hand, I am only human. So I wonder if that was really the only downside I could come up with. It's a big one, you know, that we need to work on. But yeah, me doing what I do and having the experience I do, I still am aware of that stigma myself. So
yeah, absolutely. And I think that leads really nicely on to Moira. I'd like to ask to share a wee bit about her experiences and knowledge about the issue of stigma and her research that she's done. I know it's an area of particular interest to you, Moira.
Yeah, it is, Barbara, and I, you know, from what Gemma's saying, you're right. It's called being human. It's just that whole problem of society, I guess. It made me think about a long time ago now. I was spent some time with Dr. Chris Locke in Vancouver at one of the clinics, and it was about this diagnosis, maybe diagnosis versus label issue that's around. And I still remember that day. A little boy came into the clinic with his grandmother and grandfather. His mother had recently died of alcohol-related problems, and they were now looking after him. His grandmother wanted a diagnosis because she wanted to be able to get services. His grandfather didn't want a label because he saw his grandchild as just being bullied with a label like that. And I think that's a perfect example of how perception can change, affect decisions and affect choices. To his grandfather, it was stigma. And we know from the evidence across the world, stigma falls disproportionately on women who are poorer and who have other disadvantages. It exacerbates guilt. Birth mothers in particular are highly stigmatized. And with my alcohol and women hat on, as opposed to an FASD hat, you know, it's about the isolation. For women who are developing drinking problems and frightened of their drinking, what they really need to do is to be able to talk to their friends. Actually, it's the one thing they can't do. And they become more and more isolated and they lose the support that they really do need. For pregnant women, fear of stigmatization, of discrimination, it gets in the way of good prenatal care. And it also has this problem about fears of having their children taken away. In some areas in North America, women will be more likely to report taking drugs rather than taking alcohol, because the stigma attached to alcohol is now so great. And that's fair enough in the States. You know, there are 2 or 3 states in America where women can be imprisoned for drinking in pregnancy. And it's talked about in terms of child abuse, of child endangerment. There have been a number of studies from different countries have shown that clinicians are hesitant about diagnosing FASD. We've already had the panel's comments on that. But it's important for a number of reasons. And Jan Lutke, who's on the webinar tonight, is one of the people who has kept telling me over the years, if it's not counted, it doesn't count. And I think that's absolutely right. For some clinicians, they won't diagnose FASD because there are services for children with FASD, with ADHD and autism. And that's the road they'll go down. But it also brings a diagnostic bias. And that's about, if you look at the children who are diagnosed, they're Aboriginal children, they're children in care, they're looked after children, they're fostered children. And they're more likely to be diagnosed with FASD. Non-Aboriginal children are more liable to be diagnosed with ADHD. So there's a diagnosis bias in that. And that causes problems. You're talking about numbers. Numbers with ADHD will go up. Numbers with FASD will stay the same or even go down. I think there are other issues. Parents and siblings are powerfully affected by stigma. It's a kind of stigma by association, and it can cause problems within the family as well as out with the family. Just when the family needs to work together, it'll pull apart. For siblings, they get angry that they only get told once not to do something, and their brother or sister with FASD gets told over and over again, very patiently, with no apparent consequences. And again, the isolation. Parents who really need the support of friends find themselves pulling back because friends don't like their child's behaviour and don't like the way the child's acting. Like so many other aspects of FASD, for me, the effects of stigma will change across the life course. Societal stigma, people will swallow, and it becomes self-stigma, and it heightens the risk of misinterpretation. It leads to isolation. And it's interesting, and I've never understood it, but babies and young children with FASD are often described as innocent victims. But for some reason, as they grow into older childhood and adulthood, they have this negative stereotype that leads to beliefs that parents with children with FASD, as they grow older, are dangerous and they're unpredictable. How they change from innocent victims to being dangerous and unpredictable, I don't know, but I keep seeing it and I keep hearing it. So we see self-fulfilling prophecies with older children and adults. If that's how they see me, then I may as well behave that way. One thing that always strikes me about young people with FASD, and I know a number of them, and a number of them are here tonight on this webinar, is their amazing sense of humour. It carries them through some of the most difficult times in their lives. But even that has downsides. In school, they're often seen as the class clown. And that's a way of getting friends. It's a way of being accepted. But the downside of that is the sense of humour can cost them in terms of the view of the teachers. So even things that are strengths in some ways can be seen as getting in the way by other people. I'm honestly not sure how we can begin to change this. We need to. And Raja said Raja, I can't believe it, 20 years ago, things have changed a lot in 20 years. From where I'm sitting now, some of the things we've talked about tonight would not even be talked about. So things are changing. But the only thing I can think of is almost in a different angle. There have been some German studies recently looking at stigma, and one of the changes in Germany is that people who have gone for treatment for an alcohol problem, I know this sounds kind of left field, but bear with me, people who have gone for treatment for alcohol problems are seen very positively. So actually going for treatment is seen positively. It's almost as though people have taken a step from looking at an alcohol problem to, yeah, this person's actually doing something about it, so good on them. And I think the ripples on that pool might eventually get round to helping other people with stigma. It's got a long way to go. Might not even be in my lifetime, although I'm not planning on popping my clogs right now. But yeah, as you can see, for me, stigma is a big issue. Thanks, Barbara.
No, thank you very much, Moira, and a lot of really points there that I haven't really considered before. And I think just thinking about the theme of stigma a little bit more, I'm going to sort of open this out to everybody to answer. But what would you say to somebody who suggests that we shouldn't be labelling children with FASD? Gemma, I'm going to ask you that one, because I know you've got an answer for it.
Oh, do you? Oh, good. No more than me. What would I say? Well, I come from it from a perspective of, and it feels like a very long time ago now, but I remember there was a time when I didn't want my daughter to have a label for that reason, I suppose, for that reason of, you know, stigma, not necessarily an FASD, but anything really, because I had that view that it would kind of like weigh her down, for want of a better expression, like having a label, and I'm not the kind of person that likes to label people anyway. I'm very much a kind of all shades of grey person, but I quickly realised, just even doing a little bit of research and knowledge gathering, and that just kind of relates back to what I said, that actually that label, it opens the door to many things, but also it's what you make it. I think perspective is such an important word here. I think it can very easily, whether it's a generational thing or what, you know, I know it's a complex issue, but the way that I chose to approach it is that it as a positive, and I will continue to do that with my daughter as she grows up, and teaching her how to, you know, advocate for herself and what FASD actually means. But I can see how very easily that it could be viewed as a negative as well. So I think it is all to do with the perspective that we take on it. But I suppose that's like anything in life, isn't it? You can look at it from different angles, and it all depends on the way that you frame it and the way that you approach it. And it's been life-changing, you know, for her. And hopefully that'll continue. But I was very much originally a standpoint of against any kind of label, but that changed very quickly.
Yeah, and that's the thing, is that it's not a label, it's a diagnosis, and that's something I think that all of us in the hub and all of us in the FASD community are having to remind people who don't live
when you
our
don't
life.
have that's how I saw it before.
Yeah.
When you have, you know, it's that phrase, a little bit of knowledge is a dangerous thing. When you have more knowledge and you understand, you know, the importance of the language that you use and everything like that, that perception changes very quickly. But from a standpoint of somebody who didn't know that much, yeah, your perception can change very quickly.
The lived experience makes it different, doesn't it?
Absolutely.
Carol, is there anything you'd like to add in that?
Yeah, I think it's just to reiterate what you said, it's the diagnosis, it's not a label. The labels are put on by other people not understanding the diagnosis properly. But yeah, I think for me, you know, I'm quite proud of my diagnosis, or label as you want to call it. FASD makes me me. You know, we shout that a lot. And it's true. For me now as an adult, when I say I've got FASD, there's not so much of that. It's more of a like, they want to know more, curiosity, like, what does that mean? What's that again? Oh yeah, I think I've heard about that. And it's opening up conversations, and they are being a bit more positive now. But yeah, to reiterate like what Gemma was saying, like when I was adopted, mum and dad didn't want that label put on me. They thought I had enough labels with just being adopted or being in care and everything else that went along with that. They didn't want that burden on me, and they just wanted me to be normal and fit in with everybody else, which I totally get. But it would have been nice for probably them and me to have a lot more support growing up. But you know, everything happens for a reason. I'm understanding myself a bit better now, and probably at a maturity level where I can understand things a lot better as well. So yeah. That's all I've got to say.
No, so I'm going to ask Raja if he's got anything to add that, and then I'm going to go to Miranda and ask Miranda to speak about her research and what young people are telling us about FASD.
Yeah, we've talked a lot about why diagnoses are important. You know, I mentioned before about would you refuse to do that with Down syndrome for the same importance? The whole thing about people understanding themselves. I'm just reading through, CJ's been putting on a lot of stuff on there, but for me, the big thing is a diagnosis of FASD doesn't define you as a person. You are a person first, and you're a human being first, and you happen to have a condition which is FASD. And you line up 100 people with FASD, they'll all be unique and different. Whilst there will be similarities, there'll be differences, and so it doesn't define you. And it shouldn't be that way. And I think that's a really important factor of it. A label is what other people are putting onto you to try and stigmatize you and to keep you down. It is what you do to try and improve, to understand yourself, because it is how your neurological functioning is actually happening. It's what you need to do to keep yourself safe, what to do in terms of doing things well, and that's who to get, when to ask for help, when to not. It's understanding yourself, but it doesn't define you as a person. And I think that's the key that I would like to say about that one.
Thanks very much. Miranda, would you like to share with us the views that you've heard from children and young people?
Absolutely. And I think, I suppose I'll just start with a quote maybe from my study with young people. So I was really, I think throughout my experiences as a professional and kind of just, engaging in kind of, all the learning, I'm on that process myself, kind of learning about this. What I suppose one young person said in an interview to me was that everybody talks about the FASD diagnosis, but barely any young people are asked about it. So I was like, right, there we go. That's a title for many conference talks and things I'm going down to Salford to do, which is lovely as well. But I think that's the very nature of FASD, that there's a label, there's maybe stigma, but actually if we engage with people who are actually going through the assessment, who are being diagnosed and who are actually just living with FASD, I think it's just really important to kind of get that view. So I suppose that was the main driving force behind my research. And I really wanted to understand, what was their experience of living with FASD, and how did they see it as a disability? Did it have an impact on their body? Did it have an impact on their daily functioning? What day-to-day life looked like? Did it have an impact in their participation across their life, across home, school, and the community? So those were the kinds of things I was really interested in. And also, what was their view around the FASD diagnosis? Okay. So as part of that, I was really, really lucky. Obviously had a lot of support from FASD Hub, advice and guidance from FAST and Carol as well, and Lindsay Logie, who's a pediatrician. So I had lots of really good advice because I wanted to kind of make sure that I was engaging with young people around this as well in an appropriate way, that, that they were, it was an inclusive approach rather than me conducting research kind of towards, it was actually a research process with young people themselves as well. So I'm just thinking back, it feels like such a long time, but it's not. It was just a kind of maybe about 2 years ago I started on this journey with young people. I had 8 fantastic adolescents aged between 12 and 19. They were aware of their FASD diagnosis and they were in education. So that was either school or college. They all were based across the UK, and during time, obviously with COVID, it ended up being an online study as well. So just to add to the complexity of everything. So I really have to thank, a lot of the parents who were amazing, because they did facilitate a lot of support in terms of the organization and getting access to these. So without parents, it would have made the study a lot more difficult, obviously. I suppose narrowing down some of the kind of findings. So maybe just to share actually what we did. It's called a photo voice study, which is basically a visual research method. So I kind of engaged in a process with the young people, and I kind of shared the kind of perspective of that they were going to be engaging in this research with me, and they were researchers as well, and they were going to take photographs about their life, and that together we were then going to they were going to share their messages, share their voice through the photographs and the interviews that we conducted around the research as well. I also had a parent questionnaire, lots of bits and pieces of information that came out. But for me, when I was looking at all the kind of interviews and all the photographs and everything, what probably stood out was lots of themes that we've talked about tonight. So in terms of how adolescents saw themselves, they had, all these amazing interests. They define themselves by their personalities, the comedian, the swimmer. They talked about their relationships with their families, and the value of their parents in terms of providing that nurture in their lives, and also obviously kind of providing support as well. They talked about actually the experiences of FASD within the kind of home life, within school context, and the need for adjustments as well. They recognized that, and they were able to articulate that really well. And I think for some who maybe sometimes struggled to kind of necessarily think about this whole process, that, the fact that they'd taken photographs really helped to clarify what was really kind of important to them as well in that. And I think really kind of, I suppose, importantly for tonight around the value of diagnosis, for me, the young people, they were aware of the diagnosis for themselves, but actually they explained it in a very clear and concise manner. They were able to say there was a clear kind of causal, explanation of FASD. So for some, they would say that my mom drank alcohol, when she was pregnant. They were able to say that this causes differences in my brain. Very clear in the explanations. What was really interesting, though, they didn't attribute any shame or blame to their parents at all. So that's something that really counters that perception and that, the labeling that we have from others, rather than the young people actually saying, I'm not articulating that, I'm not expressing that right now, but I do understand I have a neurodevelopmental difference. And I'm aware of those differences. And actually what they were starting to articulate was this journey for themselves that they were on. And they were all at different phases, which is totally appropriate. And actually, it's not just unique to FASD. This is what we find across lots of other neurodevelopmental conditions. That is a journey of understanding yourself and understanding yourself in relation to a disability as well. And I think the young people were really, interestingly, were giving a sense of purpose to having an FASD diagnosis, because they were saying, actually, the public don't really understand it. So my teachers don't talk about it, but, professionals don't talk about it. They don't know anything about this. Really interesting. They were also kind of articulating views about a preventative message. So for some young people, they're saying, well, actually, you shouldn't drink alcohol when you want to get pregnant. It could do damage. There's just, and they were highlighting that actually just being an adolescent and kind of the risk-taking behaviors around drinking alcohol and what it could lead to. So I was like, wow, taking this all down, just amazing. And I have to say, going through this process, it was so lovely when they got together in groups, because we met as individuals, just kind of me and them, getting to know them a little bit. We met in groups as well. And what was lovely was to see the fact that as I was facilitating this, that actually some of the young people became facilitators themselves, and they were encouraging other people to give their views, and they would say, well, wait a minute, what do you think? Or are you going to say something? Or, so it was a really lovely process. And we actually had, we did our research together. And then as part of it, I said, because I know I've got a view about things, and I really wanted to make sure their view was captured and their voice was captured. So kindly with FASD Hub, all the photos from the research, so all the young people's photos are on the FASD Hub research page, and there were some really clear views from the young people. So I asked them specifically, at the end of doing the whole process, what would you really want to share with adults in your life, whether it's parents, whether it's teachers, you know, whoever it might be, what do you really want to communicate? And it was actually messages around FASD, it was around messages around themselves. So that's all captured there. And I'm really would encourage people, if they want to see that and to share with other young people in their lives, or people that they take care of, or professionals as well, was, you know, the extent to which the young people were amazing advocates, and they are amazing advocates in themselves, and how much they could contribute to the research process. So I'm sorry, I think in my enthusiasm and writing down a couple of scribbles as I'm trying to guide me through this, I hope I've captured some of, I think, the importance of really listening to young people and really bringing them kind of through that journey together. And I think I would say to probably health professionals, educational professionals, that actually, you know, I think we've got amazing professionals. I mean, like, I work with a lot of fantastic clinicians, practitioners, and I think there's such scope to, as part of the reporting that you do around FASD, is to kind of, you know, really start that journey of a positive identity and a positive, you know, the kind of the, to encourage their kind of understanding that this is, you know, a much broader profile. It's about, you know, what you can contribute, it's what you can achieve, what we can do to help you on your trajectory. Do you know what I mean? And, you know, what do you want to do in your life as well? And recognizing, yes, you may have differences, you may have supports. That's okay. That's part of it. That's part of neurodiversity in our society. But we need to help you with that, and we want you to help yourself as well. Okay, I'll stop my I'll get off my soapbox now.
No, that's great, because our children and young people are absolutely amazing, and it's so important that their voices are heard, and we're really appreciative of people such as yourself, Miranda, who are helping us access those voices and helping those voices to be heard. We're rapidly running out of time, so I hope to get another couple of questions in, and just kind of leading on, Miranda, there from maybe, I don't know if you want your research hat on or your educational psychologist hat on at this point. But how can you've answered this question a wee bit already, but how can we help our children and young people feel positive and accept their diagnosis? And are you aware of any resources or tools that might help? And I'm going to ask the rest of the panel this question as well, if you want to put your thinking caps on.
So in terms of developing self-advocacy skills, you have to start with self-understanding. So the knowledge around that, what is FASD? What does that mean? And providing accessible language and explaining all the terms and making sure that it's not just about FASD. What does a diagnosis mean? So in any encounter and any, you know, any professional that they can meet, that they understand all of the language that's been discussed. I think that's a really important starting place. And then it has to kind of move into actual skills and practicing those skills through conversations and going into situations to practice them. So when I'm talking about skills, I'm talking about communication skills. So, you know, practicing the script of, if you were to ask for support, what would you say? Practicing those words. When do you need support? So identifying when they might need support. So having those clear conversations. So you can see why that's not a conversation for just at home. It might start at home, but actually it's a shared conversation, you know, and starting to recognize the times, what kind of supports, when do you need those supports, right? And then kind of encouraging, I suppose, that relationship with the professional, you know, if it's in the kind of education context of saying, you know, I don't know always when I want to ask for help. Maybe sometimes you could kind of give me some choices or some prompts as well. So it should be a kind of a reciprocal type, kind of a two-way street in terms of that. There's lots of lovely resources out there. I'm probably thinking mainly of the national, apologies if I'm going to get the wrong title, it's me and my FASD as well, and I was about to say National FASD Organisation. I hope I've got the right organisation there, apologies if I don't, but it's that exact process of having time and space to discuss it and to understand the language around it. And I think what we really need to start moving towards is aligning that understanding as part of the big neurodiversity picture as well. So it's not just, it is about FASD, but actually it's like other neurodevelopmental conditions. So that I think for me is kind of moving towards that acceptance.
That's great. And yes, you're right, it's National FASD have the the packs, and they are really great. And my son's feedback was it smells really good. So I mean, they're good even on a sensory level.
Yeah.
So yeah, I would definitely recommend those resources.
Sorry, I would actually say, Barbara, as well, obviously a plug for yourselves. I do love your video, Meet Charlie, as well. So
Yes. Thank
great
you. I was
animation.
going to make that plug, but I'm glad you got there.
Sorry, I got there first.
You did.
Job done.
I'm going to pop over to Gemma, who was maybe going to say the same thing. But is it how do you think you can help your daughter accept and feel positive about her diagnosis? And is there any tools that you're aware of that are helpful?
Yeah, so absolutely echo what Miranda just said, and there's just recently been an example of that. There's just been a parents' night, and she has a new teacher at the moment. Her old one's on maternity leave, and she's not been her brain breaks have not been continued. The new teacher didn't know about that. And whereas she's felt able, which I didn't know, last week she went up to the teacher and told her just off her own volition just about her diagnosis. She felt confident to do that, but she didn't feel able to say about her brain break. So just yesterday we were practicing it, and we were saying, how would you go about doing that? And eventually she was able to say, well, I don't really feel confident enough doing that. Would you do that for me? So it's kind of this balance at the moment of I'm doing some things, but she's able to do some things herself. And as she gets older, hopefully those things will become less and less that I need to do for her and she can do for herself. So it's given her that language and that strategy, and role playing, stuff like that's really, really, really helpful for her. I'd say with accepting her diagnosis, I think I was thinking as well, and I don't know, it's just a thought that came to me as everybody was talking. I realized that since she received her diagnosis, that part of her life has actually become a lot smaller. Everyone was saying how it's absolutely, it's just a part of who she is. It doesn't define who she is. It's not, as Raj said, she's a human being first and foremost, but actually having that diagnosis, FASD is actually quite a small part of her life now, but it's one that I try. So she has, and not deliberately, but I look at her life now, and she has a wide variety of friends who are all, lots of sort of neurodiversity in there. We read lots of books about, not just about how everyone's brain is different, how every family's different, how every person's different, just kind of making that part of your everyday, part of your life, that differences are normal. There's no such thing as normal. It's just everybody is different. And lots of resources, things like I really like that there's the therapeutic parenting Sarah Naish books about William Wobbly and Charlie Chatty and all those things, not specifically about FASD, but again it's looking at maybe behaviors that she has, and that understanding of, I'm not the only person out there that that behaves like this, that has these issues, and there are ways of dealing with them. There's a really good series called What Would Danny Do? And it's one of those kind of adventure books. And it's about Danny making, I think there's an education one and a day one, and there's a What Would Darla Do as well. And it's kind of going through, it's kind of teaching that the choices they make have consequences, and it's a really fun. So I'm a big believer in that kind of thing as well. And just focusing on the positives more than the challenges, I suppose, because there's so much that she is first and foremost with, the FASD is a small part of that. And it's that little and often, it's starting young. It's never going to be one or two conversations, is it? It's just got to be part of the fabric of your family. And that's the ideal anyway. That's what you strive for. Whether I achieve it, I don't know, but that's what I try for anyway.
Yeah. And Kate's popped a few links in the chat there as well, including to our FASD Makes Me animation and to some of the books you've been mentioning there as well. Carol, I'm going to give the final word to you. How can people with FASD, what would support them in embracing their diagnosis?
I think for me, and a few people have said it in the chat, it's important so that they're knowing other people like them as well, so that they don't feel isolated and alone. I know, like, reflecting back, and that was like one of the reasons why I got involved, like, with everything that I do, is that I grew up and I didn't know anybody that was one adopted. I didn't know anybody that had FASD. We've come a long way now where we're actually opening up conversations and talking about it and stuff like that. But I think it's good for people with lived experience to be involved. Find that young people, they like to see where you can reflect and say, right, I remember when I was this age, because like we do groups of young people and they're like, what were you like at school and what did you get into trouble with and stuff. And it's for them to be able to relate to someone, and then but also to see that, you know, that as you can go on to achieve great things. Like just because someone says you can't do something doesn't mean you can't. You know, if you pave the way for one, you're paving the way for all. And it's, you know, and these groups that we run for the young people, although it's not just for FASD, we do adoptive kinship and FASD together, but we bring them all together. They all know why they're there. We don't need to talk about it, but we build on skills that are transferable from like primary school to high school. They're with like-minded people through difficult transitions, with a view that then they'll go into adulthood and have this whole peer support network that, you know, people like myself didn't have, and it would be great to have that, and lifelong friends. And I think that's a really big part of it as well, because it's all great and well, you know, parents and carers, you know, they've always got your back in that, but you always want a friend that just gets you and gets, you know, when you're having a down day, when not to talk to you about a certain thing and stuff like that. So I think that's a really big part for me that will help them understand their diagnosis, and then also help each other understand their diagnosis too.
Okay. Thank you very much, Carol. And unfortunately, we have run out of time. So we've even gone slightly over, but I'd just like to really take a moment just to say thank you so much to all of our panelists for what's been a really interesting discussion. I think it's given us all lots to think about. Tonight's event has been recorded and it'll be on our YouTube channel, hopefully at some point tomorrow. Or if you look out for FASD Hub Scotland or FASD Hub UK social media, then we can let you know when it's ready. If you are looking for peer support, if you're a parent and carer, you're looking for peer support, then all in the UK are welcome to join our Facebook peer support group, and Kate will pop the link into the chat for that. You just click join the group and you'll be asked to enter your email address, and we will send you a link to a membership form to complete before we give you access. And if you're in Scotland, I know there's lots of people that have got questions around diagnosis and things we've not been able to answer, but if you're in Scotland, you can also call our advice line. Gemma is likely to answer the phone, so please give us a call, or check out our website, which is fasdhub.scot or adoptionuk.org for more information. Next month, our webinar is on Wednesday, the 5th of April, so it's only a couple of weeks away, and we're going to be joined by Mike Berry from Honestly Adoption Company, who's going to be speaking from his own experience about how we can support young people with FASD. Tickets are available now on our Eventbrite page. So I'd just like to close by saying thank you very much, everyone, for joining us this evening. Thank you again to the panellists, and we hope you all have a good night. Panellists, please don't disappear yet. We'll say good night to everybody else.